Mr. Chris Skidmore.
Thank you, Deputy Speaker. Both myself and my honourable friend, the member for Filton and Bradley Stoke, have been calling for this debate for some time, so we're grateful for the opportunity to discuss healthcare provision in South Gloucestershire. In 70 days' time, the Accident and Emergency Department at Frenchay Hospital will be closing its doors. Now, this is not a recent decision, since the decision was taken under the previous Labour government in 2005, a government which then refused to allow the decision to be referred to the Independent Reconfiguration Panel, in spite of a 50,000 signature petition of local people. And with that decision itself locally to close the A&E was also voted through by Labour councillors against Conservative opposition. Now, when both myself and my honourable friend for Filton and Bradley Stoke were elected to this place in 2010, we called a debate on the future of Frenchay Hospital in South Gloucestershire, when it was confirmed that the contracts had already been signed under the Labour government to close Frenchay's A&E, making the decision effectively irreversible. The downgrading of Frenchay will forever be Labour's legacy to the people of South Gloucestershire. I know that my honourable friend, the member for Filton and Bradley Stoke, will be speaking later on in this debate about Frenchay Hospital and the continuing uncertainty over the healthcare provision that will be based there. For the first time, this government allowed South Gloucestershire's Health Scrutiny Panel to refer recent decisions by healthcare managers to temporarily relocate beds to Southmead while investigating the final provision of beds at Frenchay to the Independent Reconfiguration Panel, something that the previous government resolutely refused to do. And as local MPs, we submitted our own statements of support on Frenchay to the IRP, along with local campaigners, and those are listed in the report's appendix. Yet we were surprised to see no statements of support that were made by the local Labour Party or by the Labour Party's candidates. Now, the publication of the IRP report into Frenchay this week highlights for the first...
Order. Sorry to interrupt the honourable gentleman. We've reached the moment of interruption, so we need to do it again.
I beg to move that the House do now adjourn.
The question is that this House do now adjourn. Mr. Chris Skidmore, please. Again.
Thank you, Madam Deputy Speaker. I'll continue from my last paragraph, which was around the publication of the Independent Reconfigurations Panel's report on Frenchay that was published this week, which highlights for the first time real concerns with the reconfiguration of healthcare provision in South Gloucestershire. These concerns are so damning that it is right that as local MPs we raise these now on the floor of the House. Not only has the IRP rightly observed that healthcare provision has been subject to continual alteration since 2005, but that is, to quote the report, there is considerable public disquiet with the process to date. Also that residents of the area should feel exasperated by the years of delay, and that the overall process to date has shown a marked lack of empathy for patients and the public who have a right to expect better. And finally, that progress to date has suffered from a lack of trust from the public. Now, the Independent Reconfiguration Panel goes on to recommend that a new approach to public engagement and involvement is required that demonstrates mutual cooperation and ensures that the public can have confidence in a quality service. Importantly, the Independent Reconfiguration Panel also notes that concerns remain about access to outpatients and diagnostics, capacity for rehabilitation services, particularly in light of housing developments, and the absence of external clinical assurance. The IRP have finally put on record, I believe, what local people and groups such as the Save Frenchay Hospital group have long been saying. North Bristol Trust and healthcare bosses must now listen to them and to the IRP in light of its damning conclusions. I am concerned, however, that history is about to repeat itself at nearby Cosham Hospital. As a member of the League of Friends at Cosham Hospital and someone who volunteers at the cafe there, I hope that might suffice as a declaration of interests. I know firsthand how cherished Cosham Hospital is within the Kingswood community. Now, in 2004, the hospital was threatened with closure. Then, a story all too familiar, the healthcare bosses said that they knew best, that there were strong clinical reasons for shutting the hospital. And yet they underestimated the determination and resolve of the Save Cosham Hospital campaign group, which mounted a remarkable cross-party campaign to save the hospital from closure. In the end, the decision to close Cosham was reversed, and the hospital underwent a £19 million refurbishment. And so far, this has included a new renal dialysis unit, X-ray and scanning department, physiotherapy and outpatients appointments, and Bristol's first freestanding midwife-led birth centre that has already delivered hundreds of babies to the local area. But the minor injuries unit at Cosham Hospital that was promised as part of the Bristol Health Services plan and reconfirmed by the 2009 business plan for the hospital, while signed and sealed, as it were, has not been delivered. Instead, the commissioning group are now considering installing a rapid assessment centre for the elderly in its place. And while obviously we have to look at an ageing population, I believe in this particular case we should be looking at the needs of the entire healthcare community within South Gloucestershire. I feel that as a local MP for Kingswood, to not produce a minor injuries unit for Cosham is simply unacceptable. With French A&E closing, as I said, in 70 days, just 70 days, if local people are in need of treatment for an injury, they will have to travel 11 miles to Yate, or have to travel across Bristol to Southmead Hospital or to the Bristol Royal Infirmary. Now, public transport, as many local people know, is to Yate and to Southmead is woeful, often taking several hours on the bus. And without a minor injuries unit at Cosham, I remain concerned that healthcare provision for the east side of the Bristol region. I've set out the case for a minor injuries unit in my letter to the Health Secretary on the 26th of February, and I'd welcome the opportunity for the reformed Save Cosham Hospital Group to meet with the Minister to present their case in further detail. I believe that there is a clear and present need for a minor injuries unit at Cosham and a clear and present danger to our local community if this is not delivered. I cannot impress enough on the Minister that I believe that just in the case of French Hospital, and in light of this highly critical independent reconfiguration panel report into the changing services at French Hospital, the ability of healthcare bosses to continually chop and change healthcare services at Cosham and in the South Gloucestershire area without regard to public opinion and confidence is extremely damaging. It raises questions, above all, over why local people who pay for their health service through their own taxes should feel, as the IRP report states, exasperated by the uncertainty surrounding the healthcare that they themselves have paid for. The people of Kingswood and the people of South Gloucestershire, as the IRP has firmly stated, deserve better. So too, we deserve better when it comes to the provision of a minor injuries unit at Cosham. We were promised a minor injuries unit. We want our minor injuries unit. And for the sake of the health and safety of local people in my community, we need a minor injuries unit at Cosham Hospital. Thank you.
Lopresti.
Thank you, Madam Deputy Speaker. Firstly, I'd like to pay tribute and to congratulate my honourable friend, the member for Kingswood, for securing this debate and to thank him for working with me closely on this matter, which is obviously extremely important to our constituents. And my remarks will focus on my local hospital, Frenchie. But before I begin, I'd like to declare a personal interest of sorts, as I've had a lot of serious health issues over the last year and have spent a lot of time in and out of Frenchie Hospital. But I think I'd like to really place on the record my huge thanks and appreciation to all the doctors, nurses and staff who looked after me and made me better when I was there. I'm pleased to say, thank you, I'm pleased to say that I've now been given the all clear and I can get on with the rest of my life. And I don't think it's an exaggeration to say I probably wouldn't be here without the care and treatment I've had over the last year, to which I'll always be grateful. Now, sadly, healthcare provision at Frenchie Hospital was to be fundamentally reduced in May until 2016 as the main part of the hospital closes. Frenchie Hospital will now have outpatients and diagnostic services and probably beds relocated. The independent reconfiguration panel, the IRP, has given their advice to the Secretary of State, which I fully understand would be unprecedented for him not to accept. I am, of course, disappointed with the IRP's decision, but they have made some extremely important points. I'm particularly concerned about what health services will be provided when Frenchie Hospital fully reopens, if it does in 2016. The future healthcare provision in South Gloucestershire and the future of Frenchie Hospital has gone through a terribly long, drawn-out process. There's been around 10 years of discussion, and it's still not entirely clear what will happen in the future. The last Labour government made the changes in 2005 when a vision was set out for health services in the Greater Bristol area, which included plans for a community hospital at Frenchie. 5 years later, in 2010, in the emerging themes proposals for healthcare in the area, again we were promised a community hospital at Frenchay. The acute care services would be moving to the new acute hospital at Southmead. The community hospital at Frenchay, we were told, would have step-down and step-up services. The step-down service was for patients who received surgery at the new Southmead Hospital to be moved to their local community hospital prior to being discharged and going home. This was in order to reduce both the number of beds required at Southmead and to enable family and friends to visit patients more easily during their convalescence. The step-up patients are those who require hospitalisation for more minor matters but do not require the full services of an acute hospital. The bed numbers for the new Southmead Hospital were planned on community hospitals such as Frenchay, being available for more minor matters. In total, it was recommended that there would be 68 beds at Frenchay. There were also to be a range of outpatient services and diagnostics and an enhanced community health service for care to be provided at home. On top of this, there was going to be space left on the site for a doctor's surgery and extra care housing and possibly in the future a nursing home. Fine, but this was not what local people wanted, but at least it was a clear plan with clear objectives. And then in July 2012, the PCT and the Clinical Commissioning Group, the CCG, began to change their mind. However, they did not fully update the South Gloucestershire Council Public Health and Health Scrutiny Committee until April 2013. At this point, they also confirmed that a stock take was being taken of outpatient and diagnostic capacity at Frenchay. In September 2013, the Council's Health Committee received confirmation that it no longer proposed to have outpatients and diagnostics on the Frenchay site. In August 2013, the CCG met and decided that for the interim, rehabilitation beds at Frenchay would be moved to Southmead for 2 years. The Conservative councillors of the Health Committee then came up with a plan and identified funds within the Council's budget to keep the inpatient rehabilitation beds at Frenchay for 2 years until the new Frenchay Health and Social Care Centre opens in 2016. They proposed the plan to the Health Committee in September last year, but to my utter amazement, the Liberal and Labour councillors joined together on the committee and voted against the plan to keep Frenchay fully open. I have to say, I felt this was purely, cynically party political and not at all in the interest of the people of South Gloucestershire. But all the Council's Health Committee could in the end as a whole agree was to ask the Secretary of State for the Health to refer the decision to the IRP. My honourable friend, the Secretary of State and the member for Surrey South West, made the referral, which I have to say is more than the previous government did. And perhaps if they did, we wouldn't quite be in the same position we are now. But as my constituent Barbara Harris, who wrote to me this morning, said, the IPR makes scathing comments on the way the local healthcare providers have handled the issue of Frenchay Hospital. As my honourable friend, the member for Kingswood, has mentioned, the IPR says that it is understandable that residents, and I quote, should feel exasperated by years of delay and amendments to plans. The IPR concludes that the whole process has shown a marked lack of empathy by the local healthcare providers for patients and public who have the right to expect better. The North Bristol Trust have now published their findings in full in relation to population growth and their stock take of the diagnostic and outpatient capacity in South Gloucestershire, as suggested by the IPR. This should be the local healthcare provider's first step in fulfilling the IPR's other recommendation on how hard they must work to regain the public's trust. I fully agree with the IPR's point that patient and public engagement must now be a core element in the design and delivery of the way diagnostic and outpatient services are delivered in South Gloucestershire. I've been saying for a long time that healthcare providers should not feel that they are able to go back on their word as and when they wish. South Gloucestershire Council, myself and our local residents need clarity on what the plans for healthcare services in our area are to be. 10 years down the line, my constituents deserve more than the ongoing confusion, the broken promises, the moving of goalposts, and I can understand why a large number of my constituents are not convinced that there's going to be any healthcare provision left at Frenchay in the future, except perhaps a care home. I would like a guarantee that health services are going to be provided at the Frenchay site in future. My constituents and I also want to know and to be reassured on what basis the services will be provided. Thank you.
Minister.
Thank you very much, Madam Deputy Speaker, and may I congratulate my honourable friend, the member for Kingswood, who brought this debate, and of course my honourable friend, the member for Filton and Bradley Stoke, who has just spoken. And it's good that we're joined in the chamber this evening by all three of South Gloucestershire's MPs, including the member for Thornbury and Yate as well, who is listening to our debate, I know with great interest as it affects his constituents as well. Before I continue and try and respond to some of the points that have been made, if I could, as I always like to take this opportunity, Madam Deputy Speaker, to highlight the wonderful work being carried out every day by those who work in the NHS, and particularly in my honourable friends' constituencies, because carrying on great work and serving the public against a backdrop of uncertainty, as we have heard of this evening, is sometimes quite difficult, but I pay tribute to the staff there and right across the country. As my honourable friend who opened the debate will be aware, the South Gloucestershire CCG is leading proposals for the future provision of healthcare services provided in the area under the auspices of the Bristol Health Services Plan. So for the benefit of the House, I hope my honourable friend will forgive me if I just put on record some of the twists and turns over the last 10 years, and I recognise the frustration that's been expressed today. I felt a sense of it myself just even being briefed about the situation, so I can understand quite how it must feel from a local Member of Parliament's point of view. Beginning in September 2004 with an extensive public consultation, this is a 10-year strategic plan which aims to improve the quality of care provided in the region, move services closer to people's homes and reduce travelling time for patients and carers, bring together specialist hospital services and improve the quality of old hospital buildings. Under the plan, Southmead was selected as the location for a new acute hospital to replace acute services at the existing hospital in Southmead and the Frenchay Hospital in South Gloucestershire. The new acute hospital at Southmead is due to open this spring. The Westgate Centre in Yate and Cosham Hospital will continue to play a role providing medical and surgical outpatient services. They will also host therapy outpatient services and provide X-ray, ultrasound and echocardiogram. Turning first to the proposals for Frenchay, as my honourable friends are aware, the 2010 proposals called for a new community hospital at the Frenchay site, providing up to 68 inpatient rehabilitation beds with outpatient therapy and diagnostic services. However, a 2012 review by the local primary care trust concluded that the proposals for outpatient and diagnostic services were not affordable and were inflexible and duplicated other services. And I quite understand that this was very disappointing, but of course CCGs are charged with using their resources in the most effective way they can for the benefit of all their residents. I am assured that the local NHS is committed to finding a long-term solution for the provision of inpatient beds at Frenchay. And while the CCG is currently commissioning 68 beds at Southmead from May 2014, this is a temporary measure while the Frenchay site is improved to accommodate them after April 2016. Turning now to the questions of the recent council referrals, and my honourable friend who led the debate has described the fact that my right honourable friend, the Secretary of State, did seize the challenge to refer this, and he's mentioned some of the comments by the panel, which we will touch on. As he described, South Gloucestershire Council's Public Health and Health Scrutiny Committee has the power to examine the proposals for service change and to refer them to my right honourable friend, the Secretary of State for Health, if it considers there are grounds to do so, and they did. And the committee made 2 referrals to the Secretary of State. The first, made in October 2013, concerned the temporary provision of rehabilitation beds at Southmead Hospital. The Secretary of State asked the Independent Reconfiguration Panel for initial advice on this referral on the 2nd of November last year. However, before this advice was complete, a second referral was received in December 2013 regarding the wider set of proposals under the plan, including the decision to no longer provide outpatient therapy and diagnostic services at the Frenchay site. Specifically, the committee cited concerns that the new proposals for diagnostics and outpatient services would not be as convenient for patients as the option of maintaining 3 sites at Frenchay, Yate and Cosham. Additionally, the committee raised concerns around rehabilitation capacity in light of population growth and financial sustainability. In January 2014, the Secretary of State asked the IRP for further advice to take into account both referrals, and this has now been received, as we have heard. After careful consideration, the panel believes that the referral does not warrant a full review. Acting on the advice of the IRP, the Secretary of State has now decided there should be no barrier to the local NHS continuing the implementation of the proposals in their current state. The Secretary of State wrote to the South Gloucestershire Council on Monday this week, confirming that he accepts the IRP's advice in full and giving his agreement to the implementation programme proceeding. Both sets of initial advice are available on the IRP's website. But both the panel and I tonight from this dispatch box acknowledge that the debate about the provision of health services in the area has been long and difficult. Delays, changes, pauses and amendments to the plans have all played a role, and progress to date has suffered from a lack of trust and poor communication. And I can only imagine, as I've said, the frustration that is felt by the local community at seeing this stop-start approach to commissioning and reconfiguring their local health services. My honourable friends are quite right to raise these issues on the floor of the House, and their constituents are fortunate that they have done so with such tenacity. I just want to turn briefly, if I can, to Cosham. As my honourable friend who raised it will be aware, the 2009 business case for Cosham Hospital highlighted that it serves a fast-growing population in the Kingswood catchment, with more older people than other parts of South Gloucestershire, and more of those suffering from long-term health conditions. I understand this growth in the number of older people has put increased pressure on local urgent and emergency care services, posing a significant challenge for commissioners. My honourable friends will be aware that in 2013, NHS England commissioned Sir Bruce Keogh to undertake a comprehensive review of how urgent and emergency care services are organised and provided in England. And the report from the first phase of this review was published in November 2013, and I think it's fair to say it has really quite transformed our national debate about the future of these sorts of services, and all parts of the NHS in England are having to essentially judge themselves against Sir Bruce's recommendations and his roadmap of what the future of excellence in urgent and emergency care looks like. The subsequent phases of that review, as say the first phase was published in November last year, could have implications for the way that urgent and emergency services are organised locally in future for the benefit of local communities. Parallel to this, the CCG decided to revisit the plans for an MIU at Cosham in order to take account of local evidence and the themes emerging from the national review. It's very clear that many people locally want to see that MIU that was originally planned and so ably argued for this evening, and they want to see it open as soon as possible, and they're frustrated about the decision to revisit previously agreed plans. For urgent care, as with all services, the CCG's priority has to be to ensure the best possible combination of services is provided to meet the needs of the whole population, and that these services are sustainable and excellent for the long term. Achieving the right mix of services at Cosham will be an important part of the solution. My honourable friend for Kingswood has made a powerful case, as has my honourable friend for Filton and Bradley Stoke, and although the task of getting that right mix about local health services is a decision ultimately for local clinicians, I would of course be happy to meet and discuss the matter and hear the case myself, in order to make sure that as a minister I have a very clearest possible understanding of the issues that affect their local area. Finally, if I can conclude, Madam Deputy Speaker, by just once again taking this opportunity to pay tribute to my honourable friends' work on behalf of their constituents with respect to these proposals, in making sure that at all turns they've explored every possibility to make sure that they are part of a very engaged process in delivering ultimately what we all want for our constituents, which is excellent local health care. I congratulate them for doing so, and I look forward to continuing to engage with them on this issue.